Bismillahirrahmanirrahim. Let's see the gestational trophoblastic disease, which we commonly call the molar pregnancy. So the patient mostly present with the early pregnancy bleeding. So it's a condition of the molar pregnancy. What is happening? What is this? This is actually the complete mole. So there are complete mole, partial mole. So these are diseases of the placenta, which is supplying the blood to the fetus from mother to fetus. So if this placenta is abnormal, so what will happen? You can see the cyst-like structure which look like the grape. So they're coming out through the cervix. So this is complete. So here you can see the partial. So on the one side there is the grape-like structure, and you can see also the fetus. So this it's a partial, complete, partial. But these are the benign condition. Okay. So these are the malignant conditions. So one is invasive. So you can see it's invading the myometrium. So here is the endometrium and then the myometrium. Okay, so it's invading the myometrium. It's an invasive mode. And then the malignant form, which is very metastatic, and but it's sensitive to chemotherapy nowadays. So it's a curative, but you can see it can invade the different distant tissue, especially lung. Then it can reach to the liver, bone, brain. So it's increase the risk. Okay. So and if you see, this is another very rare tumor, malignant tumor. So that is placental site, which is coming from the bed of the placenta. Okay. So this is a placental, but very rare. You do not see usually. Okay. So these are the common ones. So let's see. Okay. So complete mole, partial mole, and the invasive mole and the choreography. So these two are the benign. Okay, and this is a locally malignant because it's not going to the other tissue like the lung, liver, bones, or brain. So it's a locally malignant which is only invading the myometrium. It's an invasive. Okay, so benign. It's a locally malignant. It's a malignant choriocarcinoma. Okay, so but the benign has potential to become a choriocarcinoma or invasive carcinoma. 20% almost the complete mole they from the invasive mole, and 5% can cause the choriocarcinoma. So it's a benign, so where they can become malignant. So it's a locally malignant, and this locally malignant invasive mole can also become the choriocarcinoma later on. So let's start with the early the hedatiform mole or the vesicular mole. So these complete mole and partial mole are known as the hedatiform mole or the vesicular mole. Hedatiform, why we are calling them hedatiform? Because if you see the last picture, so these are what you can see the grape-like structure. So there is the cyst-like structure. So that's why we naming them the hedatiform or vesicular mole. So benign or non-persistent tumor derived from the trophoblast of placenta. These are known as the vesicular mole or the hedatiform mole. Okay, so these are differentiated because it's a benign. So differentiated with the villi. Okay, this is the picture. Okay, what is the presentation and the patient complaint? So they come in the early pregnancy with the vaginal bleeding and prone juice discharge and hyperemesis. Why hyperemesis? This is due to high beta HCG because it's a molar pregnancy. So high beta HCG that's cause the hyperemesis. Okay, nausea, vomiting, and lower abdominal pain and enlargement due to the presence of the grape-like structure in the uterus. So that's a lower abdominal pain and enlargement. So this is the patient presentation. Okay, what are the signs you find? So anemia, thyrotoxic, the hyperthyroidism because the HCG has the same alpha unit. So that's why. So they can cause the hyperthyroidism, but nowadays it's rare because early the diagnosis. So, but it can occur. Okay, and the high BP, the preeclampsia before 20 weeks. Usually we define preeclampsia after 20 weeks. So if there is a hypertension before 20 weeks, so it's one of the associated sign of the mole. Okay, so due to HCG effect. But you see in the abdominal examination, you see the uterus size is greater than the period of amenorrhea. I mean, if it's a normal pregnancy, so if there are 14 weeks, so it should look like the 14 weeks. But if it's the molar pregnancy, so size of the uterus is greater than the normal period size. Okay, so if a 14, it's look like 20. So and you see the soft uterus because of these the headed you can say cyst-like structure, so the soft uterus. Okay, and in a pervaginal examination, manual examination, you will also see the soft cervix and the vesicles. Okay, and the full adnexa, side with full adnexa. Okay. So here you can see the grape-like structure. So these are the molar pregnancy. Okay. Here is the you can see normal is size is like this. So but at 16 weeks it reaches here. So which is sign for the molar pregnancy. Okay. The etiology. So in the we have two form. As I mentioned, partial and the complete. In the partial, there are two sperm which reaching toward the ovum. Okay, so that's why there is 69 mean 23 46 plus 23 69. Okay, so triplet. So this is the but there are different form. For example, if the x is coming from here, one x is here, so XXY. So this is most common while it can occur. So mean and the sperm also give the X chromosome, both give a X chromosome and X coming from ovum. So it's a 3X or other either a 2Y. So but most common is 69 double XY. Okay. So in the complete mole, there is a single sperm which going to the anucleated ovum, or you can say empty ovum. So there is no chromosome in the ovum. So only the paternal chromosome. Okay. So 46XX. So they are coming from the sperm. Okay, not from the ovum because it's empty. Okay. So when the or other condition, two sperm reaching to the ovum, so which is X 46XY. So it is known as homozygous, which is 90% usually see you where 46XX mean both sperm are the XX, no Y. Okay, so it's a homozygous if one is X, other is Y, so it's a heterozygous, so 10%. Okay, so homozygous is 90% and 10% cases you see the heterozygous. Okay, let's see the picture. So here is complete mole, partial mole. So here is the egg, so which is with the 23x in the partial mole. Okay, so and here are two sperm reaching here. Okay, one is 23y, other is 23x. So two sperm are reaching here. Okay, so fertilized by two, so dispermy. Okay, so that's why dandry also mean you can see the triplet. Okay, so that's why triplet is happening. So this is the partial mole condition. Okay, so and there are different sperm can reach, so that's why and there can be different XXY yeah, or triple X or X double Y. Okay, in the complete mole, what is happening? Empty egg and it is fertilized by the sperm. What is happening? So the paternal chromosome duplicates, so 46XX and then 46XX. Okay, so this is the number one condition, mean homozygous mean 23X. Okay, while in the other condition, the heterozygous two egg are coming, one is X, other is Y. Okay, so and dispermy, what will happen? 23Y and 23X. So this form the 46XY. Okay, so paternal chromosomes only in this condition. Okay, so this is the heterozygous condition, homozygous and the heterozygous condition. Complete mole, partial mole. Okay. So in the pathology, what you see a uterus, you know better. It's an enlarged, soft, filled with grape-like vesicle. Enlarged, soft uterus with uh, grape-like vesicle. Okay, so it's a uterus condition. Okay, so if the macroscopic, it's a differentiated villi because the condition is the benign. Okay, and in the complete mole, you see all hydropic villi. All hydropic villi mean all the villi are hydropic. So while in this condition, you see some hydropic and have also fetus. Okay, fetus and sac and liquor. is present, so it's a partial condition. Okay, so in this condition there is no fetus. Okay, in the complete no fetus, in the partial there is a fetus. So that's why our test, which is amino staining, you can check P57, which is associated with the fetus. So if the fetus is present and it comes positive, mean it's a partial mole. Okay, if it's negative, mean it's a the complete mole. Okay, and then if you there is impact of the beta HCG on the ovary, so ovary become the theca luteal cyst. You can see cyst-like structures in the ovary, which is known as theca luteal cyst. Okay, so this is impact of the beta HCG. So or you can say this is a ovarian. It just look like the ovarian hyperstimulation syndrome. Okay. So if you what are the complication? Of course, the invasive mold 20% and the choriocarcinoma 5%. Okay, and the differential diagnosis bleeding in the early pregnancy, like ectopic abortion. So you can differentiate all these condition. Okay, and the investigation what you should do. Of course, you do the beta HCG, which is, level is very high, very high. Okay, and in the ultrasound you see the snowstorm appearance. Okay, when you see the snowstorm appearance, it's a one of the diagnostic feature for the molar pregnancy. Okay, so complete mole. Okay, and if you see fetus, mean it's a partial. If you do not see the fetus, mean it's a complete mole. Okay, and ovaries theca luteal cyst. Okay, theca luteal cyst you find in the ultrasound. Okay, and for the complication, you should check the chest X-ray, the MRI of the pelvis to whether it's a metastatic or not. If it's metastasized, so mean it's a the malignant condition, not a benign. Okay, so we should check the chest and the pelvis by chest X-ray and the MRI. Okay, so if you look at the beta HC level in the partial mole and the complete mole, in the partial mole it should be less than the 1 lakh, while in the complete mole it is greater than the 1 lakh. Okay, because of the greater involvement of the syncytial trophoblast. Okay, so here is it's a complete, so that's why it's a greater increase in the beta HCG, while in this case there is less increase. So what is treatment option? Treatment option is suction and evacuation. So you should remove all this content. Okay, so in the treatment, first you have to remove this content and look for the beta HCG if it's improving or not. Okay, so you should remove the all the content and give also the ecobolics, which remove the uterus content, and the also give the antibiotics. Okay, and follow up what beta HCG. So it usually after a few weeks it become negative. Okay, so when it's become negative, then you should check the monthly for 1 year, and also in this period 1 year give the also contraceptive. Okay, she should avoid the next pregnancy. Okay, and if the you see the beta HCG is not decreasing. Okay, and you should go for the single agent chemotherapy, mean methotrexate, if a plateau or rising beta HCG. What is plateau or let's see. Here is, for example, here you give the treatment. Okay, here you give the treatment. So after the treatment, it should decrease in a few weeks. Okay, it reaches the zero. But if it's not reaches the zero, mean it's a plateau phase. Okay, the level is somehow high, so it's a plateau phase. Other condition is if it's down after 5 to 6 months, it's again rises. Okay, so this is warning condition for the malignant. Okay, so you give the single agent chemotherapy. That's why we follow up until it reaches zero. Then we also follow for 1 year, because sometimes it's after 5 or 6 months. It's again the beta HC level rises. So there is the malignant condition. Okay, you should give them methotrexate initially if it's not improving. Okay, and give contraceptive or the other barrier method, preferably the combined oral contraceptives, alternative barrier method. If she is not taking contraceptive, she can also can use the barrier method, but she should avoid the pregnancy at least follow up. Okay, so for me 1 year. If the patient is old and she does not desire to fertile, so do the total abdominal hysterectomy. If any old age or any in the patient who have no desire for the fertility, so go for the total abdominal hysterectomy. Okay, and give NTD, the immunoglobulin, especially if a patient is Rh negative in partial mole, because in the there is exposure of blood in the partial mole, while in the complete mole, which where you see all the villi are the hydropic, while here is some are hydropic, some are functional. Okay, so that's why some blood exposure. So that's why we give the NTD in the partial mole. Here you can see the comparison of complete and partial mole. Okay, here the complete identiform mole, where you see the all the villi are the hydropic. Okay, all the villi are hydropic. While here are some are functional, some are the hydropic. Okay. So if you comparison, you know better fetus is absent and all villi are involved. So and then there is if the risk of the neoplasia, the gestational trophoblastic neoplasia, or the malignant condition. So the 10 to 30% fecal little cyst you see in 25 to 30%. And the important thing is the uterine size. One of the other differentiating point in the partial and complete, the size of the uterus is larger in the complete mole, while it's smaller, means it's near to the weeks of the pregnancy or amenorrhea. So this is in the partial, while in the large size uterus you commonly see in the complete mole. And the medical complications are mostly associated with the complete mole. And the chemotherapy, I mean, they are not responding to the suction and curative, so 15% also need the chemotherapy, and the HCG level is also high in the complete mode. So we discussed all of the point already. Thank you very much. Allah Hafiz.